Welcome to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will meet Robin Ashmore, Manager of Radiology Services at Novant Health Brunswick Medical Center. Next, we will talk to Dr. Kevin Price about his new role at Novant Health Oceanside Family Medicine and Convenient Care. And finally, we will meet nurse practitioner Lisa Long, who recently joined Novant Health Surgical Associates. So stay tuned to learn about valuable health topics with Health Watch. Our first guest today is Robin Ashmore, Manager of Radiology Services at Novant Health. Well, welcome to the show today, Robin. It's such a pleasure to have you.
Thank you very much. I'm glad to be here.
Great. Well, let's start off by learning a little bit about who Robin is. Tell me a little bit about your education and your background.
Okay. I went through radiologic technology program at a large level 1 trauma hospital in Macon, Georgia, almost 20 years ago.
Wow, you don't look old enough to do that 20 years ago,
Thank
Robin.
you very much. I am board certified in radiography, CAT scan, and MRI. I have extensive experience in the hospital setting as well as the outpatient imaging setting.
Wow, that's quite impressive. You come with a wealth of knowledge.
Thank you.
Well, tell me, how long have you been at Novant Health Brunswick Medical Center?
I just moved here October of last year. I have been with Novant. I started with Novant's outpatient imaging division in Georgia. In 2011, I moved to Fayetteville with Novant, and then October of this last year, we moved here and I joined the hospital.
Wow, that's awesome. Well, how do you and your family like it here?
We absolutely love living in Brunswick County. It's a great place to live.
It is a great place to live. I would echo that. And the weather's great and the people are phenomenal. So let's talk a little bit about your role at Novant Health Brunswick Medical Center. What is it that you do?
I'm the manager of radiology services at the hospital.
And how large of a staff do you have, Robin?
We have approximately 40 employees throughout the hospital and our outpatient facility.
Well, that's a lot of people that you have to manage. That's a big job. Well, we specifically wanted to talk today about the imaging services that you provide at Brunswick Medical Center.
Yeah, the radiology department is a full-service radiology department. We offer general X-ray, fluoroscopy, mammography, ultrasound, nuclear medicine, CAT scan, and MRI.
How did you remember all that, Robin?
I've been doing this for a long time.
Well, let's talk a little bit about those services. I mean, you rattled them off, and explain to me, like, what some of those services entail. Like, if broken bones, like, what all do you?
Absolutely, we can do the imaging services for a broad spectrum of reasons. Like you said, for a traumatic injury, we can do X-rays to look at broken bones. We can do studies such as CAT scans and MRIs to follow or stage a disease such as cancer or multiple sclerosis. And we can do exams such as MRI to look at a joint for generalized pain for no trauma or anything like that to rule out arthritis or instability in that joint.
Now, you talked about CAT scan versus MRI. Tell me a little bit about the difference between the two.
The difference between the two mainly is that CAT scan is X-ray based. Most of what we do that for, we would use that for, it's very good for broken bones. It's very good for looking at abdominal work. It's very quick, so you use it in situations like for a stroke, to rule out a stroke. MRI is an imaging modality that is based off of a magnet. It uses a large magnet, and we use that to see more detail, like with joints, like in a knee. You can see the tendons and the ligaments.
I recently had knee surgery at Brunswick Medical Center, and I had an MRI there, and what a pleasant experience compared to the older versions of MRIs. It's such a large scanner. And
it is. It's what they call a wide bore MRI scanner. And it gives you so much more room than the old scanners did. The old scanners, we had a lot of people who were very claustrophobic, and now we can scan those same people because the bore is so wide on this scanner.
I am somewhat claustrophobic, but I think what helps most is that window that's behind the unit.
The natural light coming in the room really does help.
And so you don't feel so penned in, and it's so big that you don't feel like it's closing in on you, but I digress. Now, I know that we briefly touched on mammograms. Let's talk a little bit about mammograms.
Okay.
Tell me the kind of equipment that you have.
We have a digital mammography equipment. We do preventative screening mammograms, and if required, we do diagnostic mammograms. The difference is most women at the age of 40 are recommended to have a screening mammogram every year, and that's just to make sure that there is nothing. If the radiologist feels like they may see something or there is something there, we bring them back for additional images, which is what we call a diagnostic mammogram, where they do more detailed imaging of the area of concern.
Now, I think I heard that you don't always have to have a doctor's order for a mammogram. Is that correct?
That is correct. For a screening mammogram, you do not have to have a doctor's order, and you do not have to have an appointment either. You can walk in and get
no appointments necessary?
No appointment necessary for mammogram. Now, when you do walk in, there may be patients ahead of you, and you may have to wait, or you could call ahead and schedule to guarantee a time. But another good thing is that most insurance companies now cover preventative screening mammograms as long as you're 40 years old or older, you don't have any breast problems, and that it has been 366 days since you had your previous mammogram.
Yeah, I know. We always have to write that on the calendar. It's, 365 plus 1 day in order to get our next one. So, well, that's really good to know. How many days in advance does a patient need to schedule an appointment if they need some service?
Generally, we can schedule an exam same day or next day in all modalities. Some exams, there are exceptions. It depends on the preparation that's required for the exam and the insurance requirements on authorization for that exam. But generally, we can do either same day or next day.
Really? So if I called today, I could likely get in tomorrow?
Yes.
Okay. Well, what if I've had imaging done at another facility? Can I then come to Brunswick Medical Center for those?
Absolutely. Our staff will work and find out where you had your previous imaging, and we can get those images and reports if the radiologist needs them, and we can also send the results to your primary care provider, wherever that may be. We have a lot of people who visit the area from all over, and we can take care of that. We can get the images that they had prior, and we can make sure that their primary care provider gets the results from our exams.
Yeah, especially visitors to our area. They wouldn't necessarily have their CD with them or
and we can work with them and make sure we get that.
That's awesome, Robin. That's great. Does Novant Health have any other facilities in the area that provides imaging services?
We do. We have a facility in the southern part of the county down at Sunset Beach. It's called Sea Trail Imaging, and we do walk-in X-rays at that facility. So people down in the southern part of the county that really don't want to or can't drive this far up, we can take them on a walk-in basis for X-rays in that facility.
Oh, well, that's great. So the folks in the Calabash, Little River, Sunset Beach area, they needn't drive all the way to the hospital.
For an
They
X-ray.
can have it there in Sunset Beach. Well, that's great. And do you happen to know the hours down there? Is it open every day?
It is open Monday through Friday. Friday is a half day. Right now we close at noon, but every other day we're open from 7:30 a.m. to 5 with a break for lunch.
That's great. 7:30, that's really good.
Yes.
You don't often find that.
Yes.
Well, what's the best way for someone to schedule an appointment? How do we make that happen, Robin?
There are multiple ways that can happen. When you're in your doctor's office, the doctor's office can actually call our scheduling department and make the appointment with you right there. Or the doctor's office can fax over the order to our scheduling department, and they will call you personally, find the best time for you to come in and set that up. And the last option is if the patient has a copy of the physician's order, they can personally call our scheduling department and set it up however they want to.
Oh, well, that's great information, Robin. It's been such a pleasure to have you here today, and we've learned so much, and I look forward to having you back when you can tell me about a new modality that's come on board.
Thank you very much for having me. I enjoyed it.
You're welcome. Our next guest today is Dr. Kevin Price. Welcome to the show today, Dr. Price.
Thanks for having me, June.
It's a pleasure to have you back. Now, I know you were on our show quite a while ago.
Yeah, it's been a few years.
But today you've got some great news for us. But before we get into that, I wanted to ask you to remind our viewers and talk a little bit about your background and your education.
Sure. Well, I'm 40 years old now. I've actually been in North Carolina for about 7 years. I went to med school at Philadelphia College of Osteopathic Medicine, and from there I moved to Rhode Island, where I did my residency at a community hospital there. And after that, shortly thereafter, I moved to North Carolina, and I've been in Wilmington ever since for the last 7 years with my wife and my 2 children.
Well, great, and I know you love it here.
We do. We love it.
And you love the water.
We love it. We're getting better every year.
Yeah, it's a great place to live.
It is.
Everybody agrees. When I have guests on my show, they all agree how wonderful it is to live in Brunswick County. The people are phenomenal, and the weather's great.
It's fantastic.
Yeah, it absolutely is. So I understand that you recently joined Novant Health, Oceanside Family Medicine and Convenient Care. So tell me a little bit more about that.
I did. As of June 2nd, I'll be joining that group. They'll be joining a group of 4 doctors, Dr. Christopher Eisenhower, Dr. Clark Pritz, Dr. Angela Thompson, and Dr. Rob Vidran is also there as well. And I'll be an internal medicine doctor there in their convenient care. And I'll be practicing internal medicine, adult medicine. So looking forward to that.
Yeah. Well, now, I know that's a family practice that you're joining, but you are internal medicine. Is that correct?
That's right. That's right. But I think I'm going to integrate well, given that there's a lot of folks who are adults and needing adult care medicine. And I feel that given the population that's growing here, there'll be a need for that as well. Hopefully I can fill that.
Oh, I'm sure you will. I'm sure. Now, I know the last time we had you on the show, you were in the hospitalist program at Brunswick Medical Center. And I'm curious, what was the decision, how did you make that decision to transfer back into private practice?
That's a great question. I love being a hospitalist, and I've really enjoyed the last several years doing that. But among other things, one of the things I missed is that continuity of care with patients, getting to know the patients. I think we did and we continue to do a great job of getting people well. But I miss seeing those familiar faces over and again, and getting to know people and helping them achieve their health goals. And so that's one of the things I'm looking forward to getting back into.
Well, that's good. I think you'll be very happy at that practice. That's a wonderful practice, and it's quite a busy practice.
Yeah, there are several great practitioners there. I'm looking forward to working with them all.
And several of nurse practitioners and PAs in that practice also. So it's a great mix. Now, I know you told us who your partners are, and it is a family practice, but and you're an internal medicine specialist. So tell us a little bit about what the difference is between family practice and internal medicine.
Well, family practice, first I'll say how they're similar in that there's broad-based training. But the difference is with family practice, they focus also on children's health, pediatrics, and also at times prenatal care, where I'll be focusing more on adult care medicine. And I suspect that I'll be seeing some of the patients that have somewhat more complex medical issues going on, and hopefully I can help in that regard.
Well, Dr. Price, I know that you've been in practice for about 20 years, and I assume that you have a particular focus or a special interest that you'd like to share with us?
Absolutely. When people go to the doctor, they're trying to achieve 2 things. Number one, we're all trying to live longer and feel better.
Right.
Now, what I want to focus on, first and foremost, is help people live longer, and through prevention of cardiovascular disease, preventing strokes, heart attacks, and diabetes. So I want to focus on that. and help the epidemic of diabetes that we're having.
Yeah, diabetes is a very, it's a big problem here in Brunswick County. I know through the community wellness initiative that we have, where we go out to various civic groups and entities and we test them. And it's amazing the people who are diabetic and don't know. You know, we've discovered many.
We're fortunate that our office has a diabetic educator and a nutritionist, so we're able to help people on healthy eating choices as well as promoting healthy lifestyles. So they'll be helping me with promoting those endeavors.
Oh, that's great. So you have a diabetes educator or a diabetes management nurse, and that will help the patients deal with some of the issues that arise when they have diabetes?
Absolutely. They'll help me keep a closer tab of people's blood sugars, compliance with their medication, and eating habits.
And she's there in your office?
Yes, she is.
Mm-hmm. And so folks could make an appointment with her too. When they call in, they could ask to have an appointment with a diabetes management specialist.
Absolutely.
Yeah. That would be good for folks out there who already have diabetes and know it. They could still utilize her services. Is that correct?
Absolutely.
Now, I know they have that convenient care component there, and will you be working in the convenient care?
At times I will be. I'll be seeing my panel of patients for their chronic conditions and follow-ups, new patients and the like. Mm-hmm. But I will be helping with the convenient care. We're open 7 days a week.
Wow, that's a lot.
Yeah, that's a lot of accessibility, and we're happy about that. We're open on Saturdays and Sundays as well. And with that accessibility, we're promoting MyChart, which is an online-based internet accessibility to your patient records. And we can use that to communicate with patients within 24 hours. Patients are able to communicate directly with the physician or their practitioner. And we're able to address their concerns via the internet if somebody wanted to use that route. And we're quite happy with that and trying to promote that.
I love that piece. I think that MyChart is the way to go. You have such patients can access their records, their labs, sometimes sooner than probably the practitioner does. It's just a great thing, and I love the ability that you can communicate directly to your practitioner. You can email, and then you would respond, and I just think that's
absolutely.
A wonderful
we're
thing.
trying to use the technology that's available
Sure.
to make the to get the accessibility to the physicians more easily to the patients. So I'm quite certain that will be helpful.
Mm-hmm. Well, Dr. Price, if we have viewers out there who would like to schedule an appointment, and I know you're accepting new patients, so how might they do that?
We're open 7 days a week. You can call our office at 754-4441.
Great. And they would just ask to speak or ask to make an appointment with you or any other provider who's there. Is that correct?
We're proud that if you call our office 7 days a week, you will always get a person on the other line.
Really?
And you can ask to schedule an appointment with one of the providers or myself.
That is a big plus. I love when people answer the phone.
Absolutely.
Yeah. And so I think that's very important in that practice, that you always get a person.
We're proud of that.
You should be. Mm-hmm. You should be. Well, again, it was a pleasure to have you here today, and I hope that you'll come back and let us know what's going on and how you're doing there, and anything that you would like to add to today's show.
Well, thanks for having me,
Sure.
and hopefully we'll be back soon.
Our final guest is Lisa Long, nurse practitioner at Novant Health Surgical Associates. Welcome to the show today, Lisa. It's such a pleasure to have you.
Thank you for inviting me.
You're welcome. Now, I understand that you recently joined Novant Health Surgical Associates. What brought you to that particular practice?
Actually, I had a friend that is also a Novant employee and told me the opportunity. And I have a past history of being a surgical nurse and was just very excited that there was an opening in a surgical practice.
And that's a wonderful practice.
It is, and they said there was 3 great guys and a wonderful hospital and that I should go see about it.
Well, good. Well, let's talk a little bit about your background and your education. How did you become a nurse practitioner?
Actually, I'm originally from North Carolina.
Are you really?
And I am. and I was raised in Fayetteville. My dad was a fireman. My mom was a teacher assistant. They were EMTs. I've always been around medical situations. When I was in high school, I was a candy striper.
Oh, yes.
And I knew immediately that I wanted to be a nurse. I loved science. I loved the body. I loved anything that had to do with helping people, and it was just a really good fit.
Wow, that's interesting. So where did you go to college?
I went to UNCW. And I graduated in 1994. Loved the beach, the river. UNCW was a great experience. And then actually I went back to school at UNCW to become a nurse practitioner.
Wow, that's great. We don't often get people who are from North Carolina, actually. There's so many folks who choose to live in North Carolina, and it's a great place to live. And Brunswick County especially, the people are just wonderful.
They are. I've had a really good experience. Sure. I live in Leland. And it was great to be able to work close to home at your new facility, your new hospital, and to be able to actually serve the community that I live in.
Yeah, I'm sure it is. It's a lot of satisfaction serving the people that you live nearby and your friends and acquaintances. So now we've had other providers from Novant Health Surgical Associates on the show before, but please remind our viewers who those practitioners are.
I work with Dr. DeSandre, Dr. Tilliston, and Dr. Scallion.
And I know them all. I've met all of them, and they're a great group. They're wonderful to their patients, and they just do a great job for the hospital. So.
It is wonderful. You walk in the office and you feel like your family. They're full of hugs and smiles, and every patient that walks in, you would think that they were family or friends just from the beginning. I
agree with that. The front office has a special feel. The young ladies who work there in that area who check you in, they are so lovely and just so accommodating and just so friendly, and they're just like your neighbor. So it's a great place to work.
It is.
Yeah.
That is one thing that sold me.
I'm sure.
When I came for the interview, I was like, I want to be a part of this. I want to be with them.
Yeah, it's a special place. Yeah. Well, let's talk about some of the services that are offered at Novant Health Surgical Associates.
Okay. The great thing is we are a general surgery practice, but we also, because we're in a small, almost rural community, we are offer a lot of variety. We also do skin lesions, we do colonoscopies, we do breast health. Of course, we do gallbladders, appendix. So we are able to meet a variety of people's needs so that they can stay right local and don't have to drive very far.
That's great. You know, there was a time when everybody traveled elsewhere for their health care, but I see that there's a general trend now to stay within their community. And it's fortunate that Brunswick County has that hospital and the providers that they have. So it's great to be able to just stay right here.
It is. It's definitely. They come in for maybe to have their gallbladder removed, and then they find out we also do colonoscopies, and they're like, "Oh, wow, I don't have to go anywhere," and so that makes them really happy.
Yeah, that's great. Great. Well, Lisa, do you have any special interests or particular focus areas that you would like to share with our viewers?
Sure. One of my special areas is that I enjoy working with breast cancer patients. Myself, I'm a breast cancer survivor.
Awesome.
And I really find it fulfilling and feel like that this is one of the places that I was supposed to be. Not that it's just a job, but that it's part of my purpose, and that I'm supposed to be there to help the patients either be emotionally and provide medical care for those patients.
Yes, I know they do quite a bit of breast health and quite a few breast surgeries, and I think that's so important to have somebody as yourself who can relate to those patients if necessary. You know, I'm sure women have all kinds of questions when that's happening to them, and what a great resource to have you right there. Yeah. So I applaud you.
Well, thank you. It's definitely fulfilling, and to be able to know where they're coming from and be able to relate, and also assist in our surgeons to help them navigate and provide the best care.
Are you accepting new patients at the practice?
Oh, definitely. I see patients for wound care and evaluations, and then also just assist our surgeons in the post-op care also.
Yeah, I'm a little curious about how that works in the office now. Are you do you assist the surgeons in their care of their patients, and do you have patients of your own? How does that work?
I have some patients that are of my own. I do wound care, also just evaluation or monitoring other, maybe it's a thyroid cyst or other things that just need annual monitoring. This in conjunction definitely is with our surgeons. I'm always talking to them and making sure that they're receiving their plan of care is actually coordination between me and the surgeon. But then also I assist in surgery, and so sometimes when they see me in the office, they'll also see me in the hospital. So that's really good, and I can, if they need something and our surgeons are in surgery or maybe tied up, I'm be able to provide immediate contact with someone from our office.
Now, do you see patients in the hospital if they're there for a day or two, or do you have the ability to see them? That's great. I bet they love that.
They do, because sometimes they feel like they want to see someone and kind of know what's going on and what is the plan. Am I going to get discharged tomorrow or today, so that they can plan their life, and their family and friends also can too.
Well, that's great. Not only do they get visited by their surgeon, they get visited by this beautiful woman who also takes care of them. So it's kind of a win-win.
It is, definitely.
I'm sure they love that. And I bet the surgeons love you. I bet that practice loves you. You have a great personality. You're a great fit for that practice. So,
thanks. It's been a pleasure to work with them also. Like I said, the staff is just so friendly, and it's really a family atmosphere.
Yeah, I can tell by just talking to you this little bit that you're a great fit there. It's a special practice. So if we have viewers out there who need to schedule an appointment, what would be the best way for them to do that?
They would just call Novant Surgical Associates, and they would ask for Lisa, and are able to make an appointment with me.
Well, great. Well, Lisa, it's been such a pleasure to have you here today, and I've learned so much about you and your family and your work family. So we welcome you. We're glad that you're here, and I hope you'll come back and tell us something new next time.
Great. I look forward to it.
Good.
Thank you.
Thank you. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit novanthealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
We are ATMC TV, Channel 3 and HD Channel 910, your community channel.
Is 6:30 too early for a Get Fit workout? Are your weeknights too hectic to catch the West Brunswick football? Do you find yourself missing all your favorite ATMC TV shows? Well, now you don't have to. ATMC TV is airing all their latest shows on demand. Stop, pause, fast forward, or rewind. Watch your shows on your time. Tune to Channel 1 to see shows like Brunswick Biz, Get Fit, The Coastal Kitchen, and more. Stay connected to beautiful Brunswick County with ATMC TV on demand. Brought to you free by ATMC.
Where does he work?
AMC Wireless.
AMC.